Hello, it's Dr. Rhonda Johnson, and today is Sunday, December 18th, 2022, and today I'm talking about Group A Strep, otherwise known as Strep A. Now, you may have heard about the outbreak involving Strep A in the United Kingdom in children. As of December 15th, 19 children in the UK have died from Strep A. Now, experts there say that the Strep A strains causing these deaths has not changed in the past year. It's the same Strep A that's been circulating in the UK. Now, experts say that bacterial infections often complicate viral infections, and since there has been a rise in respiratory viral infections, this may be one of the contributing factors to the rise in Group A Strep infections in UK children. Again, I will repeat that there is not a single evidence-based explanation at this time. Now, here in the United States, the CDC notes on their website that they're evaluating and looking into a possible increase in invasive Group A Strep infections among children. So I want to do a quick overview. What is Group A Strep? Strep A, it's a bacterial infection. Now, most of us have it in our throat and on our skin, and it doesn't cause any symptoms. Now, Strep A gets spread through coughs, sneezes, and skin-to-skin contact. It can be diagnosed from a rapid strep test or a culture from the throat or the skin. Now, if you get Strep A and it causes an infection in your throat, the symptoms typically include pain when you swallow, fever, swollen tonsils that have white patches on them, swollen and tender neck glands, a high temperature, and you can have a red, raised, bumpy type skin rash. Now, Strep A can also cause the following: tonsillitis, scarlet fever, impetigo, and invasive Group A Strep infection. Now, I'm going to talk a little bit about scarlet fever since it's very common in children. This is strep throat with a rash and a fever. And again, keep in mind, dark-skinned people don't often show red rashes, but they may have extra redness inside the mouth, and they too can have a rash. Now, again, symptoms are just like the strep throat infection, except for, the rash can be in the creases of the arm, elbow, and groin. It has a sandpapery feel, and it's very common. Now, Strep A can also cause skin infections such as impetigo and cellulitis. Now, antibiotics are the mainstay of treatment of strep. They can be prescribed by most PCPs or in a urgent care setting. You don't always have to go to the emergency room. But when Strep A infection becomes invasive Group A Strep, that's a life-threatening situation. Now, some IGAS stands for invasive Group A Strep conditions, and I'm just going to list them, include necrotizing fasciitis, streptococcal toxic shock syndrome, a rheumatic fever, and post-streptococcal glomerulonephritis. That's a kidney condition. Now, again, antibiotics are the mainstay treatment for Strep A. It's important to complete the entire course and don't stop when you're feeling better. In terms of prevention, again, don't share eating utensils and drinking utensils. Don't eat or drink after people. Teach your children not to do this. And cover your mouth and nose with a tissue when you cough or sneeze. And, of course, washing your hands and washing frequently touch surfaces for children in group settings such as daycare and things like that. Now, you can use dishes and eating utensils, drinking utensils after you wash them. So meaning that soap and water really works well to kill Strep A. So remember, right now the CDC is doing surveillance on Group A Strep infections in children here in the United States. So I hope that has been helpful to parents. Thank you, and take care.